Good afternoon, everybody. Thank you for being here with us. Welcome. Today we are launching our 2018 National Hispanic Hepatitis AIDS Awareness Day, Hepatitis, campaign with our first webinar. We are going to be hearing a community voice, Aracelis Quinones, who's going to speak about her own experience with Hepatitis C. My name is Luis Mares. I am the Director of Community Mobilization Programs at the Latino Commission on AIDS, and our presenter today is Aracelis Quinones. Aracelis Quinones came to New York 31 years ago from Puerto Rico. A year later, she discovered she was living with HIV with a T cell count of 30 and Hepatitis C. She realized she needed to do something for herself, for her community, and started working with the Coalition for Hispanic Family Services, facilitating a group for women living with HIV and advocating for clients' rights. She completed her CASAC certification at the Outreach Training Institute and began working with people who were using substances. She has worked at Partnership for the Homeless and Samaritan Village, working with vulnerable communities, providing workshops and counseling. Since 2000, she has worked with the Latino Commission on AIDS in different roles as Poder Latino Coordinator, patient navigation with undocumented immigrants, and with a women's targeted behavioral intervention called Willow as a coordinator. She is a proud mother of 2 boys and grandmother of a 13-year-old girl. So before we start, some housekeeping rules. Please mute your lines if you are in a noisy place, and you can share your questions or comments in the chat function, and this meeting is being recorded. I'm going to mute everybody at this point.
The conference has been muted.
So we don't have background noise. Without any further ado, Aracelis, welcome. Thank you for being here today with us.
Hi, Beto. Hi, everyone. My name is Aracelis. How everyone is doing? So I'm here today to speak a little bit about my story living with Hepatitis C, and I am proud to be here with you today, and I am honored to be working with the Latino Commission for the past 18 years. I was telling Beto that I received my Hepatitis C virus in the same year that I was tested for HIV. So it was a dual diagnosis. I tested positive for both tests. For me, it was devastating because having 2 diseases, not knowing anything, it was 31 years ago, so it was crazy. I didn't have any information, and I didn't have many options.
So it was 1988 when you were diagnosed, much before when all these medications for HIV and Hepatitis C came out. So how do you feel when you were diagnosed?
It was really bad. I was really scared. I was afraid. It was devastating. Like I said, I didn't have many options. I didn't know what to do, to whom to talk. So it was kind of really feeling like the world was going to end.
So what was your first reaction? What do you think you were going to do then?
That I was going to die. That I was going to die because it was both things that were at that time having HIV was like a death sentence. So knowing that I have HIV and also Hepatitis C, I thought that I was going to die.
So it must have been hard then.
Very hard.
So what happened then after that? What do you do? I mean, I know later you start treatment, but what happened between the diagnosis and the treatment time?
So I didn't get to treatment because I was afraid of the treatment. I knew people that was getting treatment for Hepatitis C, and it was 1 injection every day. So I was like, nah, this is not for me. So I waited. My doctor also waited, and he told me that there was going to be a new treatment that it was called pegylated with interferon and ribavirin, and that the injection was going to be only once a week. So I waited, and in 2001, I decided to start treatment.
So you started treatment with the medications that you mentioned, right?
Yes.
And it was an agreement between you and your doctor.
Yes.
So what happened with that treatment?
Well, I stayed on that treatment for 2 months. Only for 2 months because I needed to start the medication. And I had to start the medication because of the side effects.
So you mentioned side effects with this first course of treatment that you had for hepatitis C. What side effects did you have?
Oh my God, it was horrible, okay? I had, every time that I was injecting myself, I used to inject myself on Fridays because after the injection, I will have fever, high fever. I will have chills. I will be so weak I couldn't wake up from bed. So I will be like, let's say I inject myself on Friday, I will be on bed until Sunday or Monday morning. I also have vomiting, nausea. It was flu-like symptoms. It wasn't really, really bad.
And what do you do for these symptoms, for side effects? What do you?
So my doctor told me to rest, drink a lot of water, take something for the headaches and the fever. Say take some aspirin or Advil, and I did that, but it was very difficult to manage.
And for how long do you have these side effects?
For 2 months while I was taking the treatment, and then I was like, after the treatment, like a couple of more weeks still having the effects.
So you had side effects from the beginning of the treatment until you...
Immediately. It was really bad. It was a bad treatment that I really don't recommend to no one.
So would you describe your first experience with treatment for hepatitis C?
A bad experience, and after that they did a biopsy, and they found out that I have liver damage, that it was progressing, that I have fibrosis now. And still, my doctor told me that since the treatment didn't work out for me because of the side effects, that we should wait. We should wait because they were doing some clinical trials, and something new was going to come eventually. And he asked me that I needed to rest, try to do more exercise, try to manage my stress, be more aware of what I was eating, and that's what I did for many years.
So you're telling me you started treatment in 2001. In 2001, 2 months after you start.
Yeah.
And right then you were told you had fibrosis. So you knew that your liver is being already damaged by hepatitis.
Yes, I know that.
So how do you feel when you were told the treatment is not working with you and you already have liver damage?
All this time, I was very afraid. It wasn't easy living with hepatitis C and HIV at the same time. I was scared. I knew that if I didn't take care of my liver, something bad was going to happen, that I was going to die. I always had that in the back of my mind, that I'm going to die because I was dealing with 2 bad diseases at that time.
You mentioned that you were diagnosed also with HIV at the same time you were diagnosed with hepatitis C. So just a little aside from hepatitis C, how were you dealing with your HIV at that time?
It wasn't good. It wasn't good because of the HIV and the Hep C. My T cell count was very low. The hepatitis C viral load was very high, and my platelets were really, really low. So dealing with low platelet was not a joke, So for me, having to take care of my HIV, but also having Hep C and not having the Hep C under control was kind of crazy because having the hepatitis C didn't let the HIV to be under control.
Okay. So what happened after that?
Well, year 2015 came, and there was people getting cured of hepatitis C. So my doctor told me, Aracelis, there is a new medication that was FDA approved, and I would like, if you are ready, to start this treatment with you. He explained to me that it was a treatment that it was only 1 pill a day, that I was going to be taking that treatment for 3 months, and I couldn't fail, not even 1 pill. So I needed to be ready mentally, and I said, yes, I am. I want to. If people are getting cured, of course I want to be on that treatment. So I started treatment in 2015.
So from 2010 or 11, when you stopped the first treatment, until 2015, when you started the second treatment, how do you take care of your hepatitis? What do you do about your liver?
Well, like I was telling you before, I just try to eat. Well, my doctor told me not to drink alcohol. Alcohol was not going to be good for my liver. Not to drink alcohol. Try to avoid fatty foods. I have stress management, try to relax, and to drink a lot of water, do exercise. I don't know about exercise. I wasn't good with the exercise, but I try to do the other things.
All right. So, and when you started this treatment in 2015, tell me about it.
Okay, this treatment was one pill. The name is Harvoni. So my doctor told me that she had 80 patients that was going to be starting the treatment at the same time that I was starting the treatment. So we were very optimistic about this, and I was very happy that I was going to do this because people were getting cured. So I started the treatment, and I completed the treatment 3 months. After the first 2 weeks that I started the Harvoni, my viral load was already undetectable.
The hepatitis.
The hepatitis C viral load. So so my doctor was really, really happy. I was happy. I mean, it was like, wow, this is working. And I completed the treatment for 3 months.
Okay, so when you were taking this treatment for hepatitis C, with the new medication that you mentioned, you were also taking your medication for HIV.
Yes.
Okay. Did it make it more difficult for you to take care of your HIV as well?
Not really. At that time, it was good taking the treatment for the hepatitis C because since the hepatitis C viral load was going down, my platelets were coming up. My T cells also. My HIV viral load was undetectable. So I was getting better, I was feeling better, and I was happy.
So that was only my next question. Like when the treatment started working for you for hepatitis C, did your HIV improve?
Yes, if you could say yes, because of the T cell. The T cell came up a little bit, and the platelets. The platelets have always been low because of both diseases. So since the Hep C was coming down, everything was getting back like to normal, you could say.
Okay. So after you started treatment with Harvoni in 2015, after 2 weeks, 2 months, 2 weeks?
2 weeks. After 2 weeks that I started the treatment, the hepatitis C viral load was undetectable.
Okay. And how was the treatment with Harvoni? How do you have any side effects? Was it difficult to take the pill?
You could say that it was very few side effects. A little bit of feeling tired, but not really. I was happy. I mean, I was really happy with this treatment. Nothing to compare with the previous treatment. So I was happy. I was feeling like, wow, I'm doing this. I'm getting to do something that I really feel like I'm going to get cured.
And how do you take your medication? It's 1 pill a day?
1 pill a day. I used to take it every morning.
Every morning, for 3 months?
For 3 months.
Okay, so what happened after the 3 months?
Okay, after, within those 3 months, they always used to draw blood every 2 weeks, okay, to check out if the treatment was working, and it was working. Everybody was happy. After the 3 months, it was undetectable, but 2 months later, I went and I had my blood drawn, and they found that the hepatitis C virus was still there, meaning I wasn't cured, meaning the treatment didn't work. I wasn't cured. And it's sad because of all 80 patients, 79 got cured but me. I was the only one who didn't get cured.
And how do you feel when you were told that?
I was feeling devastated. I was crying. I was like, oh my God, why me? Why me? I mean, it was a bad day because I was supposed to celebrate. I was already telling people that I was cured of hepatitis C. Imagine, it was a bad experience.
So what options do you have then when you were told that after the treatment was completed and the follow-up showed that you were not cured?
Okay, my doctor said, Araceli, when you started taking the Harvoni, after 2 weeks, the viral load was undetectable. That means that it was working good. But since I had hepatitis C for 27 years at that time, and also having the AIDS, because my T cell count was less than 200, she thought that it was better if I do the treatment again with the Harvoni, but this time it was going to be for 6 months, and she was also going to include The ribavirin. Ribavirin was that pill that I mentioned before that I used with the pegylated.
The first treatment.
Yeah, the first treatment. So this time I was going to get that pill, the ribavirin, with the Harvoni, and it was going to be for 6 months.
Which is the protocol, I think, for people who
Yes.
fail treatment for
Yes.
3 months, right?
Yes.
So how fast do you start your treatment after you fail the second one?
Immediately after the 2 months that they told me that I have the Hep C virus on my body. Immediately. She didn't want to lose time. She was like, we have to get to this. So we started immediately, and I was ready. I said, yes, let's do this.
And how was this treatment? And again, 1 pill or 2 pills this time, right?
It was 2 pills, but the ribavirin, I was taking 6 pills in the morning, 6 pills at night. The ribavirin, okay, because that goes by how much you weigh. And since I'm very skinny, so I was taking the ribavirin twice a day and the Harvoni once a day.
For 6 months this time.
For 6 months.
And again, you were being tested like every 2 weeks?
Yes.
And how fast did you go negative this time?
What was that?
Your viral load for hepatitis.
Oh, it went down immediately. But also the side effects were really bad again, because the ribavirin is a pill that if you have a history of depression, they have to be very careful, because it does make you feel depressed. I don't have a history of depression. I'm always trying to be happy, but I was crying all the time for 6 months. You tell me that I was beautiful, I would cry. You tell me I was ugly, I would cry. So there was tears on my face all the time.
So the medication caused you to be depressed?
Yes, I was crying. I was feeling I couldn't walk. If I walk 1 block, I have to stop because I was short of breath.
Mm-hmm.
So it was, and at night I couldn't sleep well for 6 months.
And you never thought of stopping?
No, never. I wanted to do this. I was like, no, I'm going to do this. I'm going to do it. I'm going to get cured, and I was going to finish this.
Mm-hmm. And what happened then?
Well, after the 6-month treatment, they waited 2 weeks. They did a test. No viral load, no hepatitis C virus. And after that, they did it again, like the 6th week, and then at 3 months. And it was nothing. 2 weeks ago, I went to the doctor again, and they say, let's do this Aracelis just to check if everything is okay. And no hepatitis C. So it worked. It did work.
So it's been 3 years
Yes.
Since you were cured from hepatitis C.
Yes.
And having gone through all these experiences that you just shared with us, what would you like or what do you want to tell to the people out there that is dealing with the diagnosis of hepatitis C, or with the people that know somebody who is dealing with the fact that he has a diagnosis of hepatitis C?
Well, I will tell people that they need to get tested, okay? They need to get tested to find out if they have hepatitis C. In the Latino community, we are afraid to get tested of anything because we don't want to hear the results. We don't want to have a positive result. But it's very important that we get tested to see if we have hepatitis C. And if anyone has hepatitis C, please go seek treatment. Start treatment. Treatment today is wonderful compared with what it was in the past. Like Alejandro is writing right here.
Yeah, Alejandro saying
that he has a treatment with interferon. Alejandro, that was horrible. I know what you went through. Okay?
Yeah, I'm going to read what Alejandro says. Alejandro says, my first treatment was with interferon shots, twice a week with ribavirin. Not successful. My second attempt at treatment, my hepatitis C doctor recommended interferon for 6 months instead of the standard 3 months to make sure the Hep C virus is totally eradicated. He is fortunate he was cured the first time with Harvoni.
That's good. Congratulations, Alejandro. And yeah, my doctor told me that she felt bad because she said that she should start it with the 6 months instead of the 3 months like you. Yes. So yes, I would tell people, please get tested. Please start treatment, because I know living with hepatitis C is not easy. It's not easy. There is a stigma associated with it.
Can you tell us a little bit about your experience with stigma?
Oh my God, it's like this. People think that the only way that you were going to get hepatitis C is if you were an IV drug user, right?
Mm-hmm.
So they will tell you, esto no te cata, or things like that, okay? But also on my HIV community, I have stigma from them because during that time, if I wanted to date anyone that have HIV like me, and I told them that I have hepatitis C, they would be like, oh no, we don't want that. We already have HIV, so we don't want to get hepatitis C. So it was a lot of misinformation, and I mean, the stigma is still there,
So you felt discriminated because of the fact
Yes, I felt discriminated. I did, yes.
So do you think there is a need for education to the community out there?
Oh yes. We still need to continue educating the community.
And I think you do some advocacy on this.
Oh yes, I do, and I will continue doing until I die.
You also mentioned that you say it's a silent disease. I mean, I know that most people who's positive for hepatitis C, they don't know they have hepatitis.
Yes, because but like me, I never show any symptoms. I wasn't like people think that if you have hepatitis C, you will have yellowing of the eyes, yellowing the skin. That might happen if the disease is really, progressing. But at the beginning, I was for 27 years, and I had nothing but my liver. My liver was getting damaged, but not in the outside. You couldn't say Aracelis have hepatitis C just to look at my face.
And you mentioned that it's very important that people go and get tested. We know, and would you like to mention what group of people should go be tested more, or what's advised by CDC or by
Okay, I would say people who have been in a relationship with somebody that have hepatitis C, people who are HIV positive, people who have been in the past or present IV drug users, and those baby boomers.
Don't look at me like that. I'm not a baby boomer.
I said baby boomer, I look at him.
For 2 years, I'm not. Okay, and so you've been cured for 3 years. What has been the care that you have received and what you have done for yourself in terms of staying healthy and taking care of your liver?
Okay, now, after I got cured of hepatitis C, so I am more aware that I could get infected again if I do something to expose me to it. So now I take care of myself. Also, I have HIV, so this time I'm more aware, okay? So I recommend people to please, when they go to have their nails done, things like that, to bring their instruments, the things to cut your nails, everything, to bring them to the place, because it's not good to share those, and the tattoos and all those things, So just be aware and just take care of yourself.
And what things do you do for not get reinfected again with hepatitis C?
Well, if I have sex, I will use condom. Like I mentioned, when I go to do my nails, I bring my own instruments, and that's about it. Yeah.
Okay. So, thank you for sharing your story with us, and thank you for telling all your experiences with 3 treatment courses that you have had, with stigma and with dealing with diagnosis. Let's see, I will read Alejandro again in a minute, or I will unmute people, and maybe Alejandro will tell us what he wants to say.
Of course.
So,
thank you, Alejandro.
Before giving a voice to Alejandro, Araceli, if you had to tell one thing, what's important? What would you tell people? Do this, or don't be this, or something?
Just to get tested. Go to get tested.
Because?
Okay? Get tested because knowing is better.
Okay. So we're going to go to, I'm going to unmute now, everybody, and if you like to talk, I think Alejandro will talk, raise your hand and I will indicate, okay?
The conference has been unmuted.
Oops. Okay, Alejandro?
Yes, good afternoon. Thank you again for sharing your story. and Latino Commission on AIDS. Thank you so much for providing this information and just letting people know that this is not a death sentence. But one of the things that I noticed, and it's hard for people to absorb the understanding of the cost, because if I had to go 6 months and it cost me like $202 and $146, and each month the amount was $33,691. I have health insurance, so it covered it, and then my doctor got me a $45 copay card.
Thank you.
You know that Gilead also offers some...
Before you continue, please, people, whoever is in a noisy space, unmute your speaker. So, I'll tell you what we're saying.
I was saying that Gilead also offered board.
What is that noise?
Mike, you raise your hand.
Hello?
Yes, Mike. Hello.
This is Mike Valentine. I just want to say to my friend Araceli, thank you so much for your courage. I love you. And
How you doing, Michael?
Good, Mami. How are you? ¿Todo bien?
Bien, mi amor.
Good, Mami. I wanted to dial in and hear your story and thank you and applaud you. I love you a lot.
I love you back.
The conference has been muted.
This came, Araceli, Alejandro mentioned that the cost of treatment was very expensive, and I'm sure it's still very expensive for a lot of people. How do you deal with that?
Fortunately, I have insurance that pay for it.
Okay.
I have Medicare, so the Medicare covers it.
Which is not the experience for everybody.
No, it's not. So that's why they offer help for people who are going through this. So, like Alejandro mentioned, it is outrageous. The prices, forget it.
Okay. So, anybody else have any questions for Araceli? You can write it in the chat box or raise your hand and I'll unmute you. Well, it seems everybody has asked the questions. So, Araceli, thank you very much for coming, for being here with me today.
And my pleasure. It's a pleasure
sharing
to be
your story and the information that you have acquired during these years dealing with hepatitis C. Thank you, Alejandro, for your comments and your questions, and thank you, Mike, also. And since there's no any more questions, we're going to finish the webinar now. So thank you again, Araceli. Araceli Quinones, her contact is here, and the phone number is there. Whoever wants to ask her a question directly, you can write an email to her or call her.
Of course. Thank you guys for sharing this time with us.
Oh, hold on. There's Juan asking, he wants to know if you had any barriers with your providers.
No barriers. I was, again, fortunate to have a wonderful team of doctors. My primary doctor and my hepatologist. So I had a great team. No barriers, sweetheart. Thanks for the question. Good question.
And do you know of anybody who has barriers or problems with doctors?
Not that I know.
Okay. Thank you, Juan. Thank you.
Thank you, Juan.
Any other question before we finish? De nada.
De nada.
Okay, guys. Thank you very much for joining us today.
Gracias.
For this webinar, and thank you, Araceli, again for coming to share your story with us. We're finishing now. Remember, with our next webinar is on May 1st. It's on hepatitis overview with Dr. Torres. So we hope that you join us again on May 1st at the same time, 2 p.m. Okay, goodbye, guys. Thank you very much.
Thank you. Bye-bye.